Hey, it's Jen again. Just wanted to give you a quick update on the treatment. The reason for making videos is not just to update family members and friends. First and foremost, this is to also share my journey to other patients who is gonna undergo the same treatment that I am undergoing right now. I am currently on cycle 5, but infusion number 5 for the MOSUNETUZUMAB. But they started me on the medication called Revlimid on the clinical trial. Lenalidomide is also used for the treatment of multiple myeloma and treatment of mantle cell lymphoma. But on the clinical trial to see if it works for follicular lymphoma, which is the cancer that I have right now. So this have several side effects. Revlimid is the brand name for this medication. Common side effects that they have on the pamphlets are the low blood count, diarrhea, itching, rash, occurring in greater 30% for taking the lenalidomide. They also have the fever, cough, sore throat, infection, anemia for the side effect. And was mentioned here, serious side effect of lenalidomide is blood clot, so they start me on aspirin as well. To contact your doctor if you have a fever of 104, unusual bleeding or bruising, black tarry stools or blood in your stools, blood in your urine, and diarrhea for at least 4 to 6 episodes in 24-hour period, and extreme fatigue and swelling, shortness of breath can be also a sign of pulmonary embolism or blood clot in your lungs. One thing that was stressed out here in the pamphlet is to treat this as a chemotherapy pill, not to mix it with other medications, to drink a lot of water with it, and to make sure that to keep it away from pets, from your family members. They cannot even touch this in their bare hands. You have to wear gloves in taking this medication. And if you are on the research study, return any unused study drug to the pharmacy in original containers. And this includes the empty bottles. And they also provide you a calendar or a diary where you put in the time you give yourself the pill. Also for women, very, very important to those who are pregnant, planning to get pregnant while on this medication, would like to
Every woman in this country must be aware that it's most important that they check their medicine cabinet, and that they do not take this drug.
In the early 1960s, no drug struck more fear into the hearts of pregnant women.
One of the most horrifying episodes in medical history.
Than thalidomide.
These are the babies that was affected by the medication, and I thought of sharing it because I believe it's very, very important. Always remember, ask your doctor what are the medications you're taking and if you plan to take anything even. So that was it today. So it was the finish of round 5, cycle 1. It's gonna be a start of phase 2. And so, hey, for those who are undergoing the same treatment that I'm getting right now, or any cancer, or same cancer that I have, and if you don't need to talk to anybody, you can always send a comment below. I'll answer any questions of side effects if you have any questions. One thing I would like to share with you why I'm being so positive with the treatment and how I have undergone the diagnosis of the third diagnosis of lymphoma is having faith and prayers really help, and also taking it one day at a time. Do not worry of the future. You don't know. You read and you worry about any side effects that says there that you're gonna have fever, you're gonna have a heart attack, you're gonna have blood clots and all this, but it might not even happen to you, so why worry for things that haven't happened yet? It's just gonna wear you down. It's gonna cause you to be more depressed, and it's gonna even sometimes cause you panic attacks. So it's very normal for us to feel even just a little bit of, you know, depression and anxiety, and that's common, so don't be embarrassed about it. Talk to your family and friends about it, you know, that would help take off the load, whatever you're feeling. But hey, I just wanted to let you know, guys, that I'm also here. I understand what you're going through, and I can answer any questions as much as I can. And also wanted to appreciate the time you're spending watching this video, and if you haven't subscribed yet. So I travel a lot. I love to do that to distress me, and like to make videos of the cancer journey. So thank you for watching. Okay, so I'm done with the treatment, waiting for Richard, but while waiting, they have a shuttle to take me to the cafeteria. See you on our journeys next up.